Question here from Charlotte and Paul asking about osteoporosis. We find your programs to be the best out there for so many different issues, but we've not heard you talk about osteoporosis and cartilage weakening in older women. Do you have any specific suggestions?
Yes, I got a couple here, a couple thousand. But as women get older and go into menopause, often they get osteoporosis, which is their bones start dissolving. The only reason your body dissolves your bones, it could also stop your heart and lungs to get more calcium, but then you would be dead. So here's the thing to remember. Whenever your body does anything, thank the Lord that it's doing it. I don't care if it's pain, inflammation, or anything. Dissolving your bones, wonderful. Okay, because you can live without a very good skeletal system, but you can't live without heart and lungs. Your body has perfect responses. You're either a believer in the human body and in God and in nature, or you think we're all in hell and being attacked constantly by microbes or something. Okay, but I am a believer in the human body being an amazing, amazing tool. You learn the first week in Immunology 101, the body is a self-repairing mechanism. I got it. I didn't need any more. Why'd I sit through 2 more years of immunology? I didn't need it. The body's a self-repairing mechanism. So it's repairing you because you need calcium to stay alive, for your heart to beat, okay, for your lungs to work. But you can have brittle bones and you can still live. So when you have osteoporosis, you have to think, I need more calcium in my body. So what do people do? They take rocks. They eat rocks. They eat ground up oyster shells. Well, remember the Three Stooges did that. They threw away the oysters and crunched on the shells, and we laughed our asses off, and people are doing that every day. That's great, loaded with calcium, but you can't assimilate it. Horse shit's loaded with calcium, but I don't want to eat it. So if I want nutrition, it has to be what I consider a good quality food, not oyster shells or horse shit. It has to be a good quality food. And the first thing that always comes to my mind is carrot juice, a beautiful source of calcium. And people go, well, what about milk? You know, there's good things about milk, but bad things about that. I try to find things that there's only good things about when I'm looking for the nutrition in my body. And exercise. Exercise builds up bone mass. So we got to get away from this society. And I'm not saying this person said this, but in our society, we think of what can I take to fix this? What pill can I take to fix this? What herb can I take to fix this? And that's just a real lame response, but we don't know any better. Okay? So you have to educate yourself and others to know that it's not take a pill to fix a disease, take some calcium to fix osteoporosis. If this woman had a super food program with a rainbow in her kitchen of green leafy vegetables and all these other things, and then did enough bowel cleansing and got that bowel working perfectly and exercised and was at the gym and did her yoga and all that stuff, it would probably go away. I would say 98%. And then if it persists, then we have to look at other things. But you know what I found in my clinic? Like I said, just with nutrition in and waste out, 80% of my patients after 4 weeks forgot what was wrong with them.
Knjige doktora Ričarda Šulca, Lečenje neizlečivih bolesti, 30-dnevni program čišćenja organizma i druga izdanja, kao i biljne preparate i tinkture prema originalnim receptima doktora Šulca možete nabaviti putem telefona 063 732 7738 ili preko web sajta dršulc.com. Ukoliko želite da studirate prirodnu medicinu iz svog stana putem interneta, posetite sajt institutpm.com ili zakonizdravlja.com. Upis je otvoren tokom cele godine.